Namaste, this is Dr. Shivakumar, orthopedic surgeon, arthroscopy, sports and shoulder specialist. So let's discuss about a very common topic, the shoulder pain. Shoulder pain and stiffness comes in the form of frozen shoulder, which happens very commonly in the middle-aged people, aged about 40 to 45 and up to 50 to 55 years, predominantly in females. Reasons we don't know exactly, but maybe lack of flexibility and sometimes diabetes, hypertension, cholesterol and thyroid problems as well as vitamin D problems. So these are known to predispose to frozen shoulder because the shoulder joint has got a lot of movements. So there are so many muscles, ligaments, shock absorbers and supports inside the shoulder which can get tightened at different stages and different levels. So the treatment, if we detect this early, within 1 month, simple medicine and simple exercise will solve the problem. Sometimes it goes to the second stage where the stiffness becomes more and then we might need to give an injection and do a prolonged physiotherapy. Sometimes the treatment ranges up to 1 month. And even if that stage is also missed, many people still come to us at the end of 3 months, 4 months and 6 months. Then sometimes pain may go away, but stiffness will remain. In that case, we might need to do something called an arthroscopy keyhole surgery, where we make a small hole here and a small hole here and release the tight muscles. Once the tightness is released, the joint will become completely free. And of course, we follow it up with physiotherapy exercises and correction of diabetes, thyroid, vitamin D and all these things. The good news is frozen shoulder goes away after a period, around 1 to 1.5 years maximum. It will relieve by itself. In neglected cases, the shoulder will become almost normal but doesn't become completely normal. Some stiffness will remain. So what to do? You detect it early, control the comorbid conditions, do the exercises properly. The most common mistake our patients do is that they expect the problem to be solved with simple medicines, but they don't do exercises. Even when they go to a physiotherapist, they ask the physiotherapist to put those heat, vibration, massages and all those things, but they don't do the exercise. Do exercises properly twice a day. Make sure you correct your vitamin D and all. So make sure you meet the orthopedic surgeon, and if possible, if you have a arthroscopy and shoulder specialist nearby, please meet them. They will better guide you. Thank you.